Good afternoon and welcome to Facebook Live with Holy Cross Health. My name is Brenton Andrasic, Manager, Physician Alignment and Business Development for Holy Cross Health. Before we begin, I'd like to call your attention to a few ground rules that you'll see in the comments section. We encourage you to participate, but please keep any questions and comments general. We won't be discussing anyone's specific health situation in this public forum. If we can't get to every question today, we'll provide additional feedback through Holy Cross Health's blog, or we can connect with you one-on-one through our program channels by phone or website. For those of you joining us today on Facebook, we thank you for being here and for taking an active role in your health, and we at Holy Cross are happy to be your partner in your health journey. Today, we're here with Dr. Dimitri Sagunis, a neurosurgeon at Holy Cross Health, and Sharon Hairston, a certified nurse practitioner and our stroke program coordinator for Holy Cross Hospital. Let's start by setting the stage for the scope of this issue. According to the Centers for Disease Control and Prevention, a stroke occurs every 40 seconds in this country. That means there are over 795,000 strokes every year. And according to the American Stroke Association, stroke is the fifth leading cause of death and a major cause of disability in the United States. So, Dr. Sagunis, I'd like to start with you. What exactly do we mean when we're talking about a stroke?
Thanks very much for the question, Dr. Andrasic. That pretty much is the crux of why we're having this discussion today, to increase awareness about stroke. And stroke is basically disruption of blood to a part of the brain. And so the brain needs blood and oxygen that's carried by blood to be able to function. And when you disrupt that, whether that's because of a blockage in a blood vessel, which is called an ischemic stroke, and that's about 90% of all strokes, or if you have a blood vessel that bursts and doesn't deliver that blood supply, which is called a hemorrhagic stroke, it serves to do the same thing, which is it doesn't get blood to the part of the brain that needs it, and that leads to brain damage if that's not corrected.
And so can you tell us who is most at risk for having a stroke?
The patients who typically have stroke are patients that have other medical problems like uncontrolled high blood pressure, patients that may have cholesterol that isn't being checked or treated, patients that have diabetes that's not being controlled, patients that smoke. Those are the highest risk populations.
And we'll see as we go along here today that viewers had the opportunity to register early and submit questions ahead of time. So we have a few of those questions here. Sharon, I'd like to direct one of those questions to you. One of our viewers asked, do certain foods or a lack of exercise increase the risk of having a stroke?
Yes, actually, unfatty foods such as foods high in cholesterol or fried foods, carbohydrates and concentrated sweets, for example. Basically, an unhealthy diet will predispose you for strokes, as well as not exercising on a routine basis. Exercise helps improves if patients have the prior risk factors that Dr. Sagunis enlightened us on. And overall, this helps reduce your stress and helps to prevent obesity or decreasing weight as well. So exercise is just as important as a healthy diet to help you have overall better quality of life and healthy and decrease your risk for strokes.
And one thing that's obviously on a lot of people's minds right now is COVID. Dr. Sagunis, could you tell us if there's any connection between COVID and risk for stroke, and why it's important for people to still continue to seek out care despite the risk of COVID?
Yeah, that's also a very relevant question and something that there are a lot of myths about. We're still early in the process of finding out more about what long-term problems COVID can cause, but something that we have noticed in a lot of large studies that have come out of New York, Philadelphia, Paris, is that COVID does seem to increase clotting risk in young patients. And increased clotting risk causes increased risk of stroke. Typically, what you've been hearing about vaccines is that the patients will have clots, but on the venous side, not on the arteries. The arteries are what cause the types of strokes we're talking about. But regardless of that, We're still gathering data. We're still trying to figure out what the best treatment is. And having patients on blood thinners like a baby aspirin reduces their risk of stroke when they have COVID, is what we've seen anecdotally.
So, Sharon, could you tell us what are some of the symptoms that someone should look out for that might be a signal that they're having a stroke?
So all of a sudden, you can't talk, you can't walk. You might have weakness on one part or one side of the body. You might have numbness on one part or one side of the body. You might have the worst headache of your life. You might all of a sudden become dizzy. You might have some difficulty in vision all of a sudden, like blurred vision or double vision, or not able to see peripherally. Your face may droop, on one side, but it's all of a sudden. If you have any of those symptoms all of a sudden, call 911.
And there's a very well-known acronym that we like to use around stroke symptoms. Would you like to run through that for us?
Sure. So be fast. Any signs and symptoms of the stroke, be fast. You can do a quick test. So for be fast, B stands for sudden balance problems and you're unsteady on your feet. You might feel like you're walking like you're drunk, for example. So B is for balance. E is for sudden vision problems, as I already talked about, double vision, blurred vision, or vision seeing on a side of your periphery. F stands for face. So if your face suddenly droops on one side, that's concerning for a stroke. A is for arms. So you can do the arm test, where if you have a drift on one side, which is weak, definitely be concerning about stroke. And then S is for speech. So if you're saying the wrong word, you may have problems understanding or your speech is slurred, definitely be concerned about stroke. And if you have any of those symptoms, T is for time. Call 911 right away to take you to a stroke certified hospital.
Thank you, Sharon. That's lots of great information, and definitely want to help people to remember all of the components of that acronym. So hopefully that BFAST is something that will stick in people's minds, and it might save your life or save the life of someone that you know and love. Dr. Segudas, we had a few other questions related to symptoms come in, so I'd like to pose those to you. One is, how is it possible to have a stroke and not realize that you've had it until the doctor tells you that you've had a stroke?
Yeah, that's something that that a lot of folks are surprised about, because you think something like a stroke is pretty significant, a pretty significant event. You should know whether that's happened in the past. But the truth is that there are parts of the brain that we don't exactly have a great way of being able to evaluate. So they're what are called clinically silent parts of the brain. If somebody has a stroke in these areas, then other parts of the brain can pick up the slack, or they can not realize it because it doesn't provide a really important function. And so the only way you can tell is if you have a scan and you find it incidentally.
That's really great information. And someone else asked if there are any unique stroke symptoms pertaining to women in particular.
So not that we know of in terms of a disparity between the sexes, like what happens with a heart attack, where you hear that female patients have a different way of kind of clinically manifesting whether they're having a heart attack. A stroke affects people the same way that Sharon outlined, regardless of whether of the patient's sex or gender.
So, Sharon, you mentioned this a little earlier, but it's an important point, so I want to reiterate it. What should you do if you think that you or someone that you're with is having a stroke?
Yes, so we'll call 911 right away. And 911 would typically take the patient to the closest stroke certified center for evaluation and management.
And just to be clear, if you think that you're having a stroke, should you drive yourself to the hospital?
Please do not drive yourself to the hospital, because if you're having vision problems or weakness on one side, how are you going to drive safely? You don't want to harm yourself or others on the road. So please, and don't have no one drive you to the hospital as well. Call 911.
So let's say that someone does suspect that they're having a stroke or their loved one is having a stroke, and they call 911. They're brought to the hospital. If let's say they arrive here at Holy Cross Hospital, what happens after you arrive at the hospital? What could a patient expect to happen to mobilize care for them?
So when patients come to the hospital and the ED physician evaluates the patient, they would activate, we have a stroke team process. And that basically would consist of a SWAT team type of approach where the ED physician would evaluate the patient. The stroke team that consists of a neurologist will also come and evaluate the patient to determine the next steps of care. You'll get the laboratory done as well. You'll get a head CT to see what your brain is doing, and then once we evaluate you, then we'll determine if you will be eligible for one of our acute therapies. We're doing additional testing and getting further advice with our experts.
Excellent. And you mentioned therapies. We'll get to that in a second. You also mentioned head CTs, and so some people may not be familiar with that term. So if you could just elaborate a little bit,
Yes,
but
I
also if
apologize.
we could talk, no, absolutely. But if we could also talk about some of the technology that Holy Cross has specifically to help in the rapid diagnosis of strokes.
Yes. So a head CT basically is a CAT scan of your brain to look to see if you have any type of brain like masses or strokes or bleeds. And then also we would take a look at your larger blood vessels in your brain using rapid technology, but also still in the CT scanner to take a look at your larger blood vessels in your brain to look for see if there's any occlusions there. And then depending on the patient presentation might include also what we call a perfusion study, where we look at to see if a stroke has occurred, and also around that area of stroke, if they have an area of further risk of having a much larger stroke. So those are the different tests that we do to evaluate the patient acutely to make decisions.
Absolutely, and it's important to point out, when we talk about stroke, time is brain, and this is all happening in a process that's very well coordinated and is happening as quickly as possible to help to save as much brain tissue as possible.
Yes.
To that end, let's talk about treatments. So let's say that someone comes in and it's been determined through the diagnostic measures that Sharon just mentioned that they are in fact having or have had a stroke. Dr. Sagunas, could you talk about some of the treatment options that are available to help us for stroke patients?
Sure, and I really want to emphasize what Sharon said in terms of the patient arriving to the hospital in a hospital that is that has practitioners, physicians, nurses, all the technologists. Everybody is aware of the process to be able to treat this stroke, and so everything is moving quickly because what we really want to emphasize is that once somebody has a blockage of a blood vessel, there are 2 million brain cells that die every minute of a stroke. And so time is absolutely essential to be able to make that diagnosis and bring the patient for treatment. And so the first type of treatment that you can give is by an IV. And you give a medication which can break up a clot by trying to dissolve it. It's called TPA. It's a blood thinner, it's a strong blood thinner, but it only works when the clot is less than 8 millimeters in size. So if you have a blockage in a blood vessel and it's longer than 8 millimeters, which is less than the tip of my finger in terms of the width, if that happens, you have to do something else. You have to have physicians there, doctors who can go in and try to remove that blockage, and that's called a thrombectomy. And so here at Holy Cross, we have these physicians on call 24/7. Every day of the year. We are available within 45 minutes, less than that typically, to be able to get to the hospital, take a patient to remove that blockage, whether it's by trying to suck it out with a very, very tiny, something like a vacuum. It's called an aspiration catheter, or to basically try to fish it out with something that's like a gentle stent that you will grab onto the clot and pull it out. Those are ways to be able to remove that blockage and restore blood to that part of the brain. And like Sharon said, make sure that what is salvageable, what hasn't had any cell death, that part of the brain can breathe again, can get oxygen, and can survive, and the stroke patients can have the best possible outcome.
Yeah, these are all really important points, and I want to go back to something that both of you touched on, which is the importance of timing, and making sure that patients are able to get care as quickly as possible. And Dr. Sagunas, we've mentioned it, but I just want to reiterate, and if you could elaborate perhaps upon why it's important for patients, given the importance of timing, to receive care at a location that is able to perform thrombectomy.
Of course, and I just want to reiterate that we're doing this for awareness, because there are a lot of great hospitals here in the States and elsewhere that provide care for all sorts of disease processes, but there are not as many as you would think that do stroke care, where they can actually remove a blockage if there is a blockage in one of the blood vessels. And that means you go to a hospital, it may be a large hospital that treats other diseases, and your expectation is, okay, that's great, my loved one is going to be able to get a stroke treated. But if they don't have the physicians there, then they're going to have to transfer your loved one to another hospital. That takes time. And that time, as we said in stroke, is absolutely invaluable to be able to minimize it and to be able to get the patient treated as quickly as possible. So please know which hospitals offer this type of treatment, and go to those hospitals or request that the emergency room is taking your loved one to that hospital to be able to ensure that the outcomes are as good as possible. And Holy Cross Hospital is one of these places.
So we've talked a lot about treatment for what we mentioned at the top was called ischemic strokes involving clots. But as you mentioned earlier, Dr. Skunas, there's also hemorrhagic strokes or bleeding strokes. Could you tell us a little bit about treatment for those?
Sure. So hemorrhagic strokes, which basically involve bleeding in the brain, can happen for a number of reasons. They can happen because of high blood pressure, where a blood vessel bursts and spills blood into the brain. Depending on where it is, taking out that blood can really help a patient recover faster and recover better. There are other types of blood vessel disorders like aneurysms, which are basically weakened areas of blood vessels that can spill blood into the brain. And Sharon brought it up. Mm-hmm. If your loved one suddenly develops a severe headache, the worst headache of their life, has nausea, vomiting associated with it, you can't wake them up. That may be a type of a stroke called a subarachnoid hemorrhage, because a weakened area of a blood vessel called an aneurysm has burst and spilled blood into the brain. We treat aneurysms on routinely a daily basis to every couple of days. So it's something that we've got a lot of experience with. It's also very important. Here we do comprehensive care of patients, whether it's a hemorrhagic stroke or an ischemic stroke. We take care of any cerebrovascular disease process that you may have related to stroke.
Lots of great information there. Before we move on from treatment, Sharon, I want to ask about COVID. It's obviously, as I said before, on a lot of people's minds. Could you just tell us a little bit about what we at Holy Cross are doing to help keep patients safe, and how patients can expect to be treated, even though we are, in a COVID environment?
Yes, Holy Cross Hospital does practice safe practices in regards to COVID precautions. For example, when patients come, we check your temperature. We have hand sanitizer as well at the front entrance. We also, to have screening questions for the patients and their families, etc., that comes to our door. And then, of course, if patients do have COVID, we, have that separated from our non-COVID patient population as well. And we have, where their COVID patients are separated from our non-COVID patients.
Great information there too. So we talked a lot about treatments at this point, so let's talk about recovery. So Sharon, I'll address this to you. So let's say the patient has come to us, received treatment for a stroke. Can you just talk a little bit about what that recovery process looks like at Holy Cross?
So once the patient's admitted and we, provide acute therapies and acute management for the patient, um, we would have them then get evaluated for a physical therapist, occupational therapist, speech therapist, depending on what their stroke deficits are. And also we have, besides myself rounding with the patient and our neurologist, we have also a physiatrist also who is a rehab medicine doctor who helps guides us as far as rehab recommendations to provide the best care and for the patient for having them have the best treatment and recovery as possible.
So we do have a question that we got before the event that is related to recovery. Dr. Sagunas, I'll ask you. Someone asked if you could discuss aphasia after a stroke. So I guess first we should just define what aphasia is for everyone.
Sure. Aphasia basically has to do with speech, the ability to produce speech and the ability to understand speech. Those are different types of aphasia or a combination of both. So aphasia typically means that you have some kind of damage to the dominant hemisphere. The dominant hemisphere for most people is on the left side of the brain. So if there are certain speech areas in that dominant hemisphere that are affected, a patient may develop aphasia. Again, it just has to do with being able to speak or being able to understand.
And as long as we're talking about recovery, Sharon, you mentioned some of these things, but could you just elaborate a little bit for us about the types of resources that are available to stroke patients during the recovery process?
Well, besides having the stroke team rounding on the patient every day, having our therapist see the patient as well, we also make sure, besides the acute management of stroke while they're here in the hospital, we start to have discharge planning on day one. So, besides the medical team, we also have our wonderful social workers and case managers working with the patient and their families to get them to the next stage of their recovery with stroke, which would be whether it's acute rehab, subacute rehab, outpatient, or home. Whatever the patient needs are, our team helps regards in that transition. And then in addition to that, we also make sure that the patient has a proper medical follow-up, whether it's with Dr. Sagunas, if they had a thrombectomy done or aneurysm coiling intervention, with our neurologist as well, with me at our Holy Cross Healthcare clinic also. So we design where a patient has overall comprehensive care, as Dr. Sagunas alluded to, from admission to discharge to after discharge.
That is excellent. So we've talked a lot about symptoms, treatment, recovery. We talked about risk factors up top. Sharon, what are some of the things that people can do to lower their risk of having a stroke in the first place?
Taking the best care of yourself as possible. So eating a healthier diet, more fruits and vegetables in your diet, increasing your fiber intake. You're supposed to have 35 grams of fiber every day. And exercising. What the American Heart Association recommends is at least 30 minutes a day of any form of exercise as you can tolerate it, at least up to 5 days a week. And stop. I'm sorry.
No, go ahead,
And
Sharon.
if you smoke, stop. If you do excessive alcohol abuse, stop. Sedentary lifestyle, get active.
Absolutely. Well, we did have several questions come in advance about smoking and whether smokers are at an increased risk of having a stroke, and I think that we've definitely covered that here. Dr. Sagunas, a few people asked about second strokes. So could you just talk a little bit about what are the chances of having a second stroke after you've had a first one? And also, what are the chances of having a stroke after you've had what's called a TIA or a transient ischemic attack?
Sure. Just in terms of definitions, you alluded to a TIA, Dr. Andrasik, and a TIA is a transient ischemic attack, meaning it's having stroke symptoms that go away and they're not permanent. They last less than 30 minutes. So for a transient ischemic attack, that's a sign that there's something that could be um, unstable and putting a patient at risk for having a stroke. Patients that have a transient ischemic attack or that have had a stroke and have narrowing of blood vessels in the front called the carotid arteries, if they have severe narrowing and they've had a TIA, which is considered to be a symptom, they're at 26% per year risk of having another stroke. So obviously that's pretty high. You need to have those carotid arteries treated to be able to bring that down to less than 10%. Being on medication like blood thinners, aspirin can help if you do have buildup of cholesterol or fatty plaque in the neck vessels. And the other possibility is to have an arrhythmia, to have an abnormal beating of the heart in a condition called atrial fibrillation that can sometimes form blood clots and also cause strokes or TIAs, in which case you do need to be on blood thinners or you need to have a procedure to be able to get that heart rate back to regular to be able to avoid those strokes.
Thank you, Dr. Skutis. That's lots of great information for everyone. As we start to wrap up here, Sharon, I'd like to talk about our program at Holy Cross. And could you just talk a little bit about our primary stroke centers, what that means, and what patients can expect to get out of our programs?
So, Holy Cross Hospital, we're certified by Joint Commission and also MIMS to state. And what that basically entails is that we make sure that we adhere to the qualifications and the requirements to become a stroke certified center. We have quality measures that we must meet in order to be certified, along with providing evidence-based practice, protocols, and practices to provide the best current care for our stroke patient population.
All right, thank you, Sharon. So, we've talked a lot about stroke today, and stroke is part of our larger comprehensive neuroscience program. Dr. Sagunis, thank you for being here with us. You don't only treat stroke patients. I'd like to give you a few minutes to talk about some of the other types of conditions that you treat.
Yeah, thanks. I'm a cerebrovascular and neuroendovascular neurosurgeon. And what that means is basically I treat any abnormality of the blood vessels of the brain and spine. And that, as Dr. Andrasik alluded to, involves large blockages in blood vessels that cause stroke, aneurysms, which are the weakened areas of blood vessels, to repair them, to keep them from bleeding. Abnormal connections between the arteries and the veins called arteriovenous malformations or dural arteriovenous fistulae, blocking of blood supply to tumors to be able to help have them taken out, and collections of blood in the brain, like something called a subdural hematoma, where you can treat these without necessarily doing an open surgery. That's just some of the things we do, and we do them all here at Holy Cross.
All right, great, thank you. Looking at our comments in Facebook Live, I do just want to. We had a few that weren't necessarily pertaining to stroke, so I would just like to direct anyone who has some non-stroke related questions to our Holy Cross website. We can also reach out after the event, but we do have a great Find a Doctor tool on the holycrosshealth.org website for you to help to find someone to address any other issues that you may have. We talked a lot about Holy Cross Hospital today. I do just want to make sure that we mention that Holy Cross Germantown Hospital is, of course, also a primary stroke center, and that stroke care is available there as well. So we are coming down to the end of our time today. So thank you, everyone, for tuning in. If we didn't get to your question, we can provide additional information through the Holy Cross Health blog, or we can connect with you one-on-one through our neuroscience service channels via phone or our website. You can connect with us to learn more about neuroscience and about stroke specifically at holycrosshealth.org/stroke. So thank you for joining us today on Facebook Live with Holy Cross Health. Thank you, Dr. Sagunas. Thank you, Sharon. And for everyone on Facebook, we hope to see you again soon.
Thanks very much.
Thank you.